I'm one of the UMEC members, and I'm going to introduce our speaker for this workshop today. Workshop's entitled Mission Possible, Effective Leadership Communication Skills for Women in Medicine. And what a timely topic after Dr. Nadine Katz's presidential address this morning. And leading the team is Dr. Teresa Lazar, who is an MD, MSED. And I'll turn it over to Teresa to introduce her team and start the program. Thanks for being here, everybody.
Thank you, Sue, for that introduction, and welcome. We're happy you could join us virtually at this APGO Faculty Development Seminar. I'm Teresa Lazar, Assistant Professor, Clerkship Director, and my colleagues, I'll let them introduce. Michelle?
Hi, everybody. My name is Michelle Francis. I am an OB-GYN at Mount Sinai West. I am an assistant professor, and I have quite a few hats. I am the site director for the OB-GYN clerkship at my institution, and I am the chair of the Executive Oversight Committee at Icahn School of Medicine.
And our colleague, Dr. Suzanne Yancey Bush, unfortunately couldn't attend today, but we appreciate and acknowledge all her contributions to the workshop and her mentorship. So if everyone's ready, we can get started. I will share our screen. Okay. So none of us have any disclosures or conflicts of interest. The learning objectives for today, to recognize the gender equity gap in academic medicine, to identify essential communication skills as leaders in the medical profession, and to identify opportunities to use the communication skills for career advancement. And so all of us as women in medicine throughout our careers identify communication as an important skill and made efforts to develop this skill, and we'd like to share them with you today. Oh, I'm sorry, I'm having trouble advancing the slides. Oh, here we go.
Okay, so we have a few activities. One, we're going to start with a poll. Two, we're going to have a brief presentation on gender equity and essential communication skills. And then we're going to have a few activities. One is to define your message. And two, we're going to have a couple of role-playing activities. Hopefully we can get through at least one or two of them before the end of the session. And then at the end of the session, we'll debrief and we'll review some of our take-home points.
So we're going to, and please, we'd like to keep this session interactive. If you have any questions, please don't hesitate to ask at any point. We're going to start with the Slido Google poll. So you can access the poll on slido.com with the code 491468, or scan the QR code on the following slides. We'd like to know who's here. Please let us know your age group. To start, I think, thank you. Okay. A nice mix in ages. Thank you. All right, so we're going to go to the next question. What is your current academic title? We have a few: medical student, resident, assistant professor, associate professor. Okay, wonderful. So, okay, and as you'll see, this reflects the current status of women in medicine based on academic titles, very consistent. Okay, we're going to go to the next question. What is your current medical education title, position at your institution? And this is going to be a word cloud. Okay, a nice mix, participants. Very reflective of med ed. which is great. Thank you. And a lot of experience here to be shared. Okay, what do you consider an effective communication skill? Just before we get started to get an idea. I like what I'm seeing, directness, listening, clarity. Absolutely. And we're going to cover some of these on this session. So we're going to start with a brief presentation. We're going to start with gender equity. This is from the executive summary from the AAMC. Gender equity is an integral component to achieving excellence through diversity, inclusion, and equity. And there are 4 areas identified by the AAMC where we need to focus on as women in medicine for gender equity: the workforce, research, leadership and compensation, and recognition. Regarding workforce, women comprise about 50% of graduates from medical school, but represent 35% of the workforce of physicians actively practicing. And women's representation in specialties varies. OB-GYN, 50% of women comprise the specialty, as opposed to orthopedics, where it's 5%. In research, there's a gender gap in authorship and peer-reviewed publications. The majority of editorial boards, peer reviews, grant review boards are comprised with the majority of men, and research funding awards are higher for men than for women. And regarding leadership and compensation, women are not promoted as quickly or to the same leadership level as men. So there's this gender parity at the start of medical school, at the graduation of medical school, but once the careers progress, there are less and less women in leadership positions. And the predominance of women remain at the instructor level, and they're offered less salary, starting salary, negotiated pay, resources, and bonuses as they progress throughout their career. And regarding recognition, women receive less honors, speaking engagements, invitations, and awards. And this may be a reflection of the lack of professional networking circles for some women, or their women are written about differently when they're referenced in their careers. So there's a lot of work to be done. And as we mentioned and acknowledged, communication is a leadership skill that we hope will advance women's careers in medicine and try and achieve equity in all these areas. So here's a graph presenting the information regarding gender equity gap in medicine and the academic levels of women in 2009 and 2008. If you see, the majority of women are at the instructor and assistant professor level, then followed by associate professor and professor. There are fewer. We have made some progress since 2009. And this is another graph representing the academic levels of women in medicine. And again, we start about 50-50, just about, with medical school applicants and graduates. And as there's a progression throughout the medical school career, medical career, at a faculty level, there's a persistent decline. So by the time there's associate professors, they're about 37%, professors 25%. So there's a lot of progress that has to be made in order to achieve leadership and being able to make decisions that can impact our careers and have the resources to do so. And that's why APGO is so wonderful, where we have a community to network and share this information. Does this information surprise anyone? Just curious.
Sadly, no.
Okay. I think For us, I think when we started this presentation, we had a general idea, Sue, but we didn't realize the extent of it until we saw the numbers, which speak for themselves. So Michelle, turn it over.
You need to unmute, Michelle.
Clearly not that well adjusted to the Zoom, sorry. Hi, again, my name is Michelle Francis and wanted to talk a little bit more about why the gender gap still is present. So the American Association of University Women published a report in 2016, which discussed some of the reasons why they think the gender gap does exist. And here are some of the reasons listed here. I don't think any of them are that surprising, but I wanted to talk about them in a little bit more detail. So we have the old stereotypes, right? We have the agentic type of characteristics that are usually ascribed to goal-oriented people. You know, if you're going to be assertive and demanding and proactive, those are roles, those are characteristics of people who are typically going to be leaders. And then you have these communal personality or characteristics. And those characteristics are more thoughtful and heartwarming and careful and other terms that and more communal and thoughtful. So because women tend to fall into those roles and men tend to fall into more agentic roles, and since those agentic roles are typically perceived as leadership roles, you can see where the gender divide occurs. And then the other issue, of course, is that if women step out of their classic communal roles, they may not be as well perceived by their peers, whether their peers are men or women. And so a woman that steps into classic male qualities, they tend to be perceived as aggressive, they tend to be perceived as shrill, as pushy, and as domineering. And these perceptions of women who try to take on more demanding leadership roles, those negative stereotypes are perceived by both men and women. So the connection issue is mostly related to, oh, Terry.
Okay.
Typically women have fewer connections if there are more men in leadership roles. And so those definitely impact their ability to do things such as publish and to engage in public speaking activities. These can definitely impact a woman's ability to advance into more leadership type roles. The bias and discrimination piece, again, this is another discussion with that is similar to the stereotype discussion. And then there's a concept of what's called intersectionality, which also takes a little bit of the bias and discrimination piece and adds a dimension that makes it more challenging for women as well. And then the less flexibility issue, unfortunately, we're still in a place where women have challenges with work-life balance. They tend to have more responsibilities in home, and that will also impact their ability to assert themselves into and push themselves into leadership positions. So I just wanted to bring all of that together into one slide, that we have societal, academic, community, institutional, and individual and interpersonal barriers that prevent women from achieving advancement in leadership positions. And so when Terry and I and Suzanne talked about this, we realized that, you know, while there's so many different factors that play into whether women have the opportunity for leadership positions, we wanted to work on something that we as individuals had a greater impact on, and that would be communication skills. So why are communication skills important? Oops, sorry. Communication skills are important because it's a way that we can communicate information or pass information from one group to another. And it's also the way that we receive information. So communication skills work both ways. And so today what we'd like to do is share some of the things that we learned in our studies. And there are about 6 components that are important for essential communication. And please keep in mind that while we were working on this workshop, we are learning just like you are. And by no means are we experts in the field of communication. So we still make mistakes and we're still learning. So be patient with us. And hopefully at the end, we all learn a little something about how we communicate. So there's 6 essential communication skills, and I'm going to briefly talk about 3 of them. 1 is staying strong, 2 is staying succinct, and 3 is dimensionalizing content. And for staying strong, one of the ways that we can present ourselves as more powerful and more assertive is to open our statement with a confident, very clear message. And that may be something that you have to practice at home. That may be something you can come up with off the cuff. But one of the things we tend to do, and this is based on this study that we reviewed by Grant, is that women tend to open up their statements with fillers, and instead of coming out strong with a very clear statement. So trying to minimize the ers and the ums will definitely give people the impression that we are more confident and very clear in our message. Staying succinct, this is something I have a problem with, but trying to keep the message as tight and as focused as possible. Women tend to elaborate and give more details instead of trying to keep the message focused. And while there's a difference, which seems like a marginal difference between the time that it takes one man to answer the same question as a woman, those seconds can make a difference. And then dimensionalizing content. So one of the things that's important for us to do is add numbers and content that is easy for the receiver to listen to and to understand what we're trying to say. For instance, I can tell someone that I've been the site director at my institution for a long time and I've worked really hard. And instead I can say, I've been at this institution since 2003 and I've been the site director of the Ob-Gyn clerkship for 18 years. And giving a little bit more dimension to that description, I think is a more powerful message and can make the listener receive your information a little bit better.
Okay, and now going on to the 4th essential communication skill, owning your voice. It's important to promote yourself when you're communicating. Women tend to be very collaborative. They use we, us in communication, which is very important. But it's important to promote yourself as well. So using personal singular pronouns such as I, me, my, is important. Again, keep in mind that these are suggestions considered effective communication skills, but adapt what works for you. And but self-promotion is important for advancing your career. So consider the pronouns, singular pronouns, I. Also, controlling movement. You want effective gestures, and you want gestures that are correlated to your content, and you want to minimize nervous gestures like twirling your hair, fidgeting, and the movement should be related to your content. You could be a very effective speaker once movements are controlled, and which isn't always an issue during virtual conferences, but in person, probably more so. Projecting warmth. It helps to establish trust and builds relationship in communication, smiling, relating to your audience, and relating to the content. And it develops a leadership presence. So on the screen, we included three pictures of women we felt were effective leaders and communicators. Michelle Obama, well known for her speaking abilities, presentations, a lawyer by training. And you could see how effective her gestures are. She's smiling. And there's that warmth. And Sheryl Sandberg, she was COO of Facebook and a leadership position at Google, wrote the book Lean In for women in their careers. And she's also a very effective speaker, communicator. And Dr. Walensky of the CDC. Recently, you may have seen in the news that the CDC has been criticized for their lack of timely communication. So stressing the importance of communication in our medical careers. So pulling it all together, a leadership presence. You want to center yourself in communication. Your posture should be centered, your voice balanced, gestures balanced. Ideas should be structured with a focus on rhythm and moderate pace of your voice and presentation. So you're really the center of communication, and we hope that these skills will help promote and advance your career if you're able to practice them every day and make them part of your skill set. So now we'd like to move on to practicing these skills. It's a process, but the more you practice, the more you'll be ready when you encounter situations where you need effective communication. So there are three concepts: the elevator pitch, the feedback, difficult conversation, and negotiation, discussion with your chair or boss. And we're going to cover all of these. The first one we figured as a group, and if the size of the group is conducive, we can stay all together during these role plays, or if you prefer a breakout room for the feedback and negotiation skills, we're open to that as well. So let's see some information on the elevator pitch. Being prepared, highlighting your skills. Being prepared to share them is important because these opportunities present themselves very quickly. And if you're prepared, your response will be more structured. Staying concise and to the point is key. Having one take-home point with 3 bullet points can help structure your elevator pitch. Providing value for your audience, know your audience and the information you want to convey. And creating an impact. You can create an impact by highlighting your skills and accomplishments, defining your value and what you can contribute. And if you manage to create one word or develop one word that reflects you, it creates even more of an impact. And of course, applying essential communication skills will help with your elevator pitch. So these are a checklist of the effective communication skills that we provided for you. Please keep these in mind during the scenarios and as a resource. So let's get started. The elevator pitch, faculty. Can someone read the scenario for us, please? If not, I'll be happy to. Okay, you're in the elevator after a meeting, thinking about an exciting new opportunity that was just announced by your department leadership. You're very interested in applying for the role. It aligns with your skill set and would lead to a promotion. All of a sudden, your department leader has stepped into the elevator. The elevator is going up, and there are a number of stops before they will be getting off. Now is your chance to quickly communicate the value you will bring to the role and deliver your elevator pitch to an important stakeholder. And department leadership role. A leadership role recently and suddenly opened up, and you need to fill the position ASAP. You just announced the position to the faculty in a meeting. You have a brief break before heading to your next meeting, and you're in the elevator to head back to your office. So there's not much time, but there's an opportunity to craft your elevator pitch, an opportunity to introduce yourselves here at APGO as a think, pair, share role-playing situation, and share your accomplishments and skills. We'll be happy to hear them and develop the elevator pitch. Do we have any volunteers? It's a very open role, whatever you're thinking of applying for, whether it's a promotion, a new role, a committee chair? Any volunteers? We're planning to do this as an open session, but if you prefer a breakout room, we're happy to break out into the rooms now. Okay, I'm just going to review one thing. So I can continue with the elevator pitch strategies. Opportunities to use the elevator pitch occurs when you're job hunting, you're tapped for a new role, there's a performance review, networking opportunities, you can control your narrative. And it's important to have more than one elevator pitch. Okay, I can stop sharing for a moment if you'd like to break out into rooms. Any thoughts?
I'm game for whatever.
I was
Okay,
gonna say, we could,
stay here.
yeah.
I'm happy to be the volunteer. I'm just not quite sure what role I'm applying for.
Okay. What is your current role?
I'm an associate program director for the OB-GYN residency at Baylor College of Medicine.
Oh, fantastic. Well, welcome. And you could apply for the program director role if it opens up. You know, your colleague may have an opportunity they want to pursue and suddenly decide that it's time for a change. And it would be a natural progression from your current position and definitely a promotion. Would that be an option?
No, I'm happy to, I'm happy to do that.
Thank you.
Do you want me to pretend like I'm in the elevator and give my pitch?
Yes, if that's okay, if you don't mind.
That's
We're happy to
fine.
hear it.
As long as you will be kind with your feedback, I'm happy to try.
Yes.
We're going to talk about feedback and the culture of psychological safety that we need to create.
Perfect. Perfect. I'm doing a similar session at APGO Creog in a couple months, so I expect you guys to be there and to be my volunteers.
We'll do. We'll be there.
Okay, perfect. So I'm going to use the names of my actual people in my department. I hope that's okay. It just makes it more natural to me. So Dr. Belfort, I see that you announced at the faculty meeting that you are looking for a new residency program director because Dr. Kilpatrick is moving on. As the associate program director, I am very interested in this role. During my time as associate program director, I have helped bolster the resident evaluation process, created the resident wellness initiative, and really worked on building our resident as teachers program. I'm very interested in growing in this new opportunity with your support. What would I need to do to continue to find out more about this opportunity?
That was fantastic. Yes. Thank you so much for sharing. You have an impressive background and experience in this field of medical education. I would promote you. And I think you presented yourself very well, very structured, very centered and balanced with a wonderful flow. And you opened it up to feedback and how to move forward, which I thought was very important. But you promoted yourself very well.
Okay.
Is there any feedback from the group?
I think she did a fantastic job on the fly. I mean,
Yes.
it was just perfect. It was short, sweet. It, like 1 to 2 floors on the elevator, not a 25 floor elevator speech at St. Luke's Hospital at Baylor, So it was perfect, right on point.
Yes.
Yes, concise with a take-home point, very direct.
I do have a question. So as I'm speaking, my heart is racing. even just in the, is there anything you got, or does this happen to you all? And
Yes.
what do you do to help control those physical manifestations of anxiety?
That's an excellent question, because I think no matter how experienced a speaker you are, communicator, I think a lot of us experience that. So structuring your response, first of all, I couldn't tell. I think that's important to realize that even though you're feeling it, you're not necessarily reflecting it. So focusing on what you're saying, the structure and the flow. And once you get started, I think it's easier. Just getting started, I think, is the hard part.
Oh, that's great. Thank you.
Great. So I'll start sharing my screen one more time. And anyone else want to share? Okay. You're also very brave.
That's a hard act to follow. Good luck.
Yes. And I think you'll be in that position in a very short period of time, probably. So again, if you're job hunting, tap for a new role, performance review, networking, you can use an elevator pitch at any point and every day. And the more you use it, the easier it'll be. All right, so moving on to the difficult conversations. This will be in a breakout room, providing feedback in challenging situations and negotiation in a difficult setting. So some information about feedback. Michelle, it's all yours.
I'm sorry. I'm not sure if anyone's ever given feedback before, but it can be pretty challenging, especially if the feedback needs to be constructive. It can be challenging for the person to receive the feedback, and it definitely can be challenging for the person to give the feedback. So we wanted to go through an exercise where the tension can be perceived just by reading the dialogue and the description, excuse me, and then give an opportunity for the group to use this exercise in a breakout room. We can go to the next slide. So I wanted to briefly review the situation behavior impact model. And this model can be used in just about any arena where you need to give feedback. One of the most important details to keep in mind with this situation behavior impact model is to keep your feedback strictly to the facts. And that way, the person that's receiving the feedback can hear what is the issue, as opposed to hearing the commentary that may be involved with the emotions that come with giving the feedback. Advanced planning and growth mindset are also very important. One of the things that I've read quite a bit about in the feedback strategies is that in situations that are challenging, advanced planning and having a growth mindset can make the transition from wanting to give feedback to actually giving the feedback a little less uncomfortable. And so the advanced planning means that you really sit and think about all the things that you need to cover, and using terms that put you in put the feedback in a more positive light, so that the person can receive the feedback. And as most people, when they receive feedback, it can be a little bit painful. Working in a culture of trust and psychological safety seems to be the place where we really need to go, as far as being in a place where giving and receiving feedback feels more like a gift instead of feeling punitive. And I don't know if there are institutions that have reached this nirvana. We are definitely working towards that place. But until then, giving feedback in a constructive way will help build that culture of trust and psychological safety, so that you can get to a place where feedback does feel like a gift. And then, no matter how well you plan and how much you keep a growth mindset, and even in the culture of trust and psychological safety, sometimes your feedback doesn't go well. Whether the person that you're giving the feedback doesn't receive it, or even in your delivery of the feedback, it may not go as well as you'd like. And so reflecting on that feedback is an essential so that in the future you can do a better job. We can always learn from our experiences, and then that's an opportunity for growth and maturity. Next slide.
Negotiation. So negotiation strategies, talking with your chair will be the scenario. Again, being prepared and ready for a challenge. Structuring your response, knowing what is important to you, prioritizing what your goal is can help prepare yourself. Knowing what the market value is, if you're negotiating a salary, knowing what resources you're interested in, asking for a promotion. There's so much that you can negotiate: flexibility in hours, locations. So it's important to know before you head into the meeting what's important to you, setting your goals. It's also important to know what the person you're negotiating with is interested in accomplishing, or what their goals are. And if you can find a common ground, that's will help the negotiation. And it's important to know what you're willing to negotiate for the most and what you're willing to compromise on, but to hold your ground. And unfortunately, women tend to negotiate less than men. They tend to be, they do not initiate negotiation as much as men. And in order to advance, it's important to negotiate. Negotiation occurs every day, even if we don't realize it. And the more you perfect these skills and communicate them, you'll be ready when it's higher stakes. So being concise is important as well. Having your goals set ahead of time is going to help with that. You want to recognize and avoid emotion. And between the both stakeholders in the conversation. Emotion will detract. You want to stay focused on what's important and that common ground. And that's going to help, because if you approach negotiation as a win-win for both parties, then you're going to be more successful as negotiation than considering it adversarial. You want to start with that take-home point. What's your main goal? And the 3 bullet points. And define your value for the institution. Know what you can contribute, what will advance, what you can leverage ahead of time. Do your research ahead of time, and this will give you confidence in your negotiation. Also, recognizing a department's need or gap, how you can contribute to fill this, and that will lead to a more successful negotiation, because the other party also has needs that, and support, looking for support to accomplish this and direct the department forward. So you can work together in negotiation to meet common ground and advance on both sides if it's approached that way. Any questions regarding negotiation? We're going to break out into rooms shortly, and we can discuss this further at that point. Just the breakout rooms. They're going to be 2, one for feedback, one for negotiation. We'll work in small groups. We're going to upload the descriptions of the scripts ahead of time. They are on the Whova app, but we're also going to upload the files in a PDF. And if you could download it, they'll be uploaded in the chat. Uploaded before the breakout rooms if possible. It doesn't always transfer over. There will be a faculty role, a learner's role, and the observers. Think about the effective communication skills. There's a direct observation checklist, which we'll download as well. We can debrief in the rooms, and then as a group, when we come back, once you start the role play, if the 2 participants can keep their video on and the observers keep their video off, it can be more effective that way. And we're going to start the breakout rooms. Let me stop sharing. I will upload.
So we'll be doing one. We'll either be doing the feedback or the negotiation. We don't do both.
Okay.
Is that right?
Yeah, in each room, or you could choose if you want to do both, that's fine.
Okay. Just
Yes,
getting
there's
getting
that
the
option.
instructions, yeah.
I don't know if we have the time, I think, to do both in each breakout room if you prefer. Yeah, we'll be flexible with that. Thank you, Michelle, for uploading your file on feedback. If everyone could download it. And I will, welcome back, everyone. I know these are complex scenarios. Apologies, we didn't have more time to delve into them, but the scripts are available to you if you want to share them back home and practice with your teams. We can debrief. I'll start sharing my screen again. Yeah, debrief and reflection. Michelle, which scenario did you have? Did you role play with your group?
We didn't even get a chance to finish debriefing, which was, I had sent you a text. I don't know if you got
I know,
it. But
I didn't have control over the breakout room at this point, sorry.
so, I mean, I can let the other two participants, give some feedback about how they thought the scenario went. I thought it went as expected, but you can ask Sue and Tara what they thought.
Carrie, you want to go first?
Sure. I was the QI faculty member who had to break it to a senior faculty member that the management of the case was not optimal and that the baby was still recovering in the NICU. So it was, when you have somebody who is more senior to you, more experienced, and you have to reflect on an experience that didn't go as well for them as it could have, it's intimidating. And in this case, this was someone who was a mentor when I was a resident, and now I'm a new faculty. So that's even, even more intimidating that the person you've experienced, you've worked with them before. So the heart-wrenching stuff was definitely there. I think I reflected back on, continuous learning and tried to just sort of say, this is something you taught me. We continue to learn. We always learn and reflect back on our cases. And I think Sue did a great job being my senior colleague. I think it's just great to have these experiences to try, honestly, to work together and to practice.
That's what it's all about. Thank you for sharing that, Tara.
Yeah. And then I was the seasoned obstetrician who didn't want the young whippersnapper I trained coming in to tell me I had done something wrong. And even though, as I was sharing with Tara Michelle, even though I knew we were role playing, I still had heart palpitations and felt very defensive about the delivery and the outcome of the baby. So, but Tara did a really good job of, I immediately threw her a hard ball, like, I don't know why you're here talking to me. Chris is kind and just talked softly through it and said, we just need to go over this. Are you ready? And so she did a great job.
Thank you. And I think we can all relate to that scenario. Okay, and our group also did the feedback scenario. Bonnie, Rachel, do you care to comment and share how you felt the role play went?
I think it went well. I was the older attending in the scenario, and similar to Dr. Cox, I also had palpitations, even though I was not actually in the situation. It is, when you're trying to do the right thing, it's hard to receive negative feedback, especially in retrospect from someone who is not there. So I think that was a good learning opportunity. I think both people did a great job.
Yes, and you both kept your composure. It's a challenging situation where emotions can run high, and I think both of you kept it concise, direct, without being confrontational, which can easily happen in a situation like this. So again, please feel free to use the scripts and the scenarios with your teams back home. We're gonna move on and debrief a little more as a group, just take home points for feedback. Michelle?
And so just to give a little feedback about my group, I was very impressed with the perceived pushback that each one of them was giving, but obviously being respectful of each other's space. It was very easy to be defensive in this situation. And Tara did a great job of trying to engage the older faculty member in a way that would ingratiate them and hopefully be more receptive of the constructive feedback that was definitely in her plans. So again, the conversation about situation, behavior, and impact, this may not have applied as directly because of the scenario, but anytime you need to give feedback to someone in a workplace scenario, trying to keep it as concise and depersonalized as possible makes it easier for the person who's receiving the feedback to receive it, to actually accept what's being told and hopefully use that to improve. And again, with the advanced planning and growth mindset we discussed earlier, and the most important thing to have in a feedback culture is psychological safety. And again, this comes from these very small interactions that all of a sudden become part of the culture of your institution, and continuing to be positive in your feedback model, I think will definitely bring that to bear. And then reflecting on your feedback, of course, just so that you can improve.
Thank you, Michelle. Okay, and take home points for negotiation, talking with your chair, strategies, again, being prepared, knowing the information before going in, knowing what's important to you and to your chair, finding that common ground. There's a term called BATNA, best alternative to a negotiated agreement. That's sort of options that you have if you don't come to an agreement. It will give you confidence to know you have an alternative or a backup, but go in knowing what you'd like to strive for and accomplish in the negotiation. So again, avoiding the emotion, focusing on that goal and supporting it, defining your value, promoting yourself, and acknowledging what the department's looking for as well, or needs to fill a certain role or goal to accomplish. And so negotiation, performance review, tap for a new role. These are all important features in negotiations, and have more than one strategy because everything is a negotiation. So being respectful of the time. Michelle?
Oh, I'm sorry, I can't. Okay, so just like every other conference that I've been to, at the end of the conference, I write down a couple of important points that I want to take home with me to New York City and commit to that change. And one of the best things I've ever experienced in these conferences is the list of things that I want to do. And I would say, thankfully, I can get through about half of them over the course of the year, which really does improve my lifestyle and my commitment to education and to just to be better. So if you have time before you go back to your real life, sit still, give yourself 2 to 3 minutes of writing down the things that you want to commit to change, and you can make this mission possible.
Just a few more slides. Resources available to you from this workshop: the essential communication skills chart, which will summarize the essential skills, what to focus on for each skill and how to improve each skill, just as a foundation, role-playing scripts with the checklist, so you can focus on developing those skills, take-home points. It's good to reference them and keep you focused as you develop these skills. And a nice collection of references. This was drawn from a lot of articles. The communication skills was the grant article here. Communication essentials for female executives to develop leadership presence, getting beyond the barriers of understanding accomplishment. So it is a wonderful resource, but there's a lot of content here that you can review on your own time. It's a nice collection. So we thank you all for your participation, for joining us today. And we feel we've accomplished the mission for effective communication. And we hope you find your voice and advance your careers. Thank you very much. Please feel free to reach out.
Thank you, Teresa and Michelle. This was a wonderful session, and we really appreciate the sharing of the resources and the content that y'all delivered. So great job, ladies. Thank you.